is COVAX. The COVID-19 Vaccine Global Access, COVAX, is a worldwide initiative working to ensure fair, equitable access to COVID-19 vaccines for every country that participates. COVAX is a collaboration between Coalition for Epidemic Preparedness Innovations, CEPI, Gavi, the Vaccine Alliance, and the World Health Organization, WHO, with UNICEF. COVAX, ensuring global equitable access to COVID-19 vaccines play. The COVAX solution promises the greatest likelihood of success in achieving this goal, as it can provide the largest and most diverse portfolio of COVID-19 vaccine candidates. The Gavi Advance Market Commitment for COVID-19 Vaccines, Gavi COVAX AMC, is a binding contract, providing a mechanism to stimulate suppliers to invest products in low-income countries. COVAX is one of the 4 pillars of the Access to COVID-19 Tools (ACT) Accelerator, an initiative begun in April 2020. The ACT Accelerator aims to raise financial support for accelerated research and development, production, and globally equitable access to COVID-19 tests, therapies, and vaccines. In its inception, COVAX planned to deliver 2 billion doses of COVID-19 vaccine by the end of 2021, particularly in low to middle-income countries. This represents roughly 20% of the vaccine needs of participating countries. By the end of August, 330 million doses had been released for delivery, with 230 million being delivered to 142 of the participating economies. According to Gavi, the Vaccine Alliance, the key COVAX milestone of 2 billion doses released for delivery is now expected to be reached in the first quarter of 2022. In the latest update to this scheme, on the 23rd of September at the Global COVID-19 Summit, the United States contributed an additional 500 million doses of the COVID-19 vaccine to be delivered through COVAX beginning in 2022. Several countries also pledged additional dose donations for countries around the world, including through the COVAX facility. The supply of COVAX is expected to continue to expand into the first quarter of 2022, reaching it also up to 6 billion doses available full supply by the end of March. Challenges in scale-up at manufacturing sites that supply COVAX, in particular supply of the AstraZeneca and Johnson & Johnson, J&J, vaccines. The supply forecast is expected to evolve, as it will be regularly updated based on the best information from manufacturers come up with a further analysis by Gavi and UNICEF. The September supply forecast notes that should the export ban from India be lifted, and J&J returns to its earlier commitments for 2021 supply, additional doses could become available to COVAX at the end of 2021. As such, COVAX partners have issued an urgent call to action for the lifting of export restrictions, for manufacturers to deliver on their commitments, and provide transparent updates on queues and delivery schedules. COVAX partners have also called for countries who have achieved high coverage of a vaccine uptake to give up their place in the queue to COVAX and Olmec participants it supports. Moreover, to increase volume, shelf life, and lead times for vaccines, acceleration, expansion, and systemization of dose donations are expected, which will allow countries to prepare to receive rollouts.